Yeah, that's a good question. I think we always have to talk. We talk about personal risk a lot, right? So know yourself, know your risk. So certainly, if you're older, you have health problems, you take medications to suppress your immune system, you need to be real careful right now because Delta variant is very, very contagious. If you have an immunosuppressing condition, you ought to go ahead and go get your third dose of vaccine, and you can talk to your doctor about that. And indoor events, unmasked events, lots of people in tight spaces, all the same principles we've talked about from the beginning are part of the equation. So we would encourage places to be careful in having those kinds of events. I get emails every single day. Hey, we're planning X event, and this is how should we do it? Where should we do this? And it's all about your willingness to accept risk and then alleviating risk by spreading out, being outside, being socially distanced, masking if you need to, knowing your own risk, and then avoiding those places and let us get through this surge before we make decisions. Otherwise, I have family members who have had cancer, and so they've gotten have gotten cancer treatments. They've gotten their third dose of vaccine, and they're real careful right now. And it's unfortunate because in the middle of the summer, it felt like, oh, we can do some more things, but let's get through this wave before we venture too far out for the most vulnerable folks. Yeah, thanks for asking. They're tired. I'm tired. We're all tired, right? I know all of y'all are tired of dealing with this, and so I think I think there's a mixture of things. There's certainly frustration when patients come in who are still even hostile to the diagnosis of COVID when they have COVID. They say, well, I don't have that, or you're lying, or those kind of things. We occasionally get those things. And certainly we have had team members who've dealt with verbal assaults and sometimes worse. And that's discouraging. And I think it's discouraging for them when they see somebody who could have been vaccinated and wasn't, and now is in the hospital or certainly died of COVID, and often runs through families. They're dealing with, whole families presenting that are having that issue. And so, but it's a resilient group, and we're trying to support them as best we can. We'll get through this. I think it's a challenge. I think, but for the most part, they are performing at a really, really high level, and they have for a long time. And remember, most people that go into healthcare, this is a calling; it's not a job. And so I'm inspired every single day for our nurses, those ICU nurses, those critical care nurses. And what they put on the line every single day, and that's why they went into it. If it was just a job, they all would have left. But it's not. It's something bigger than that, and that's really inspiring. So that's what keeps me getting up every day and doing this, the long hours, day after day, and week after week, and month after month at this stage. As I see what they do, and I say, I got to do my part because I know what they're doing at the bedside every day, and I see patients, but I'm not decked out in the PPE like they are every day and all day long. So I appreciate the question. If you know somebody who works in healthcare and they're worn out, reach out to them because you can't really escape it. And a weekend away isn't enough time. We all need vacations, but 2 days doesn't cut it. You don't show up on Monday refreshed if you got 2 days off, and they're working 12-hour shifts. And the other thing is we're pulling team members in from other parts of our organization to go back to the bedside, maybe who were nurses in the past, and they do some other important role for us now. And they're going back to the bedside, and that's a shock to the system when you haven't been, you got to go back to the bedside and work in these long hours that you haven't done in a number of years. So we're all hands on deck, and we'll get through it, and we're caring for the patients. And I can't say enough about our teams and how they're performing.